So welcome to our sim room. This is one of the sim rooms that we have at our facility. As you can kind of see, it's somewhat of a blank canvas, so we add or subtract to the room to make it different patient care areas. We can make it an ED, an OR, we've made it a nursing home, we've made it a disco. You're really only limited by your imagination and what you can bring in and take away. What we do when we bring our participants in, the first thing we do is show them the room, let them kind of ease into the environment, and then we show them how to call for help. So there's a few ways to call for help. Hit this blue button. That sends out a call light in the hallway and a noise. You can also cancel it with the gray button there. We also have the ability to have live phones in our simulation suites at our center. So by live phone, it means that there's actually a number that you dial and it gets to the control room. And so we orient them to how to use the phone to call for help that way. We also let them know that there's Confederates in the room. The Confederate, as you'll find out a little bit later in the course as well, is meant to help facilitate any equipment needs that are come up during the scenario, as well as if there's any issues as far as the mannequin, can I do this or can I not do this to the mannequin, they can help answer that so the scenario can go forward. They are also playing a role, so they may be playing a physician, they may be playing a nurse or a paramed, they may be playing a family member or a social worker. And so Confederates always have a role that's built around them. They know what the scenario is, but they also know their role as well. And so they may be very helpful, or they may be very junior, or they may be an expert. And so it just depends on the role that they're given. So we always tell our participants that they are playing a role that is not representative of their actual practice in real life, but they are there to help you and to guide the scenario. The other aspect of a Confederate's role is to help guide the scenario if the scenario is going off track. We have our Confederates wear earpieces and radios, much like this, but it's a one-way communication. So I communicate to them and they don't communicate back to us, just to keep it real. So obviously if they were talking back answers to the air, that would look a little strange. So it's just a one-way communication point, but it allows me or whoever's running the computer or the simulation to actually guide things the way I want it to go as well. You've written the scenario, but your students or your learners or your participants have their own set of skills and experience, and they really drive the scenario. So you have to be open for unanticipated actions from the learners and have contingency plans in case they do something with a scenario that you didn't anticipate. We do a lot of working on the fly in simulation, but we also try to have built-in contingency plans and backups for if this happens, we're going to do this. I want to introduce you briefly to Laerdal's Sim Baby. If anyone wants to come a little closer, feel free. This mannequin is kind of a medium range mannequin in that it has quite a few capabilities. You just were introduced to 3G, and he blinks and he has a lot of physiological capabilities. This mannequin has quite a bit as well. You can see that it doesn't blink, but you can change the pupils out manually. You can have a bulging fontanelle if you want, or a sunken fontanelle. You can put in a nasal airway. You can do an oral airway, an LMA. You can intubate this baby. You can do laryngospasm, you can make the tongue swell, tongue edema. So these are all things that you can set on the mannequin console, which we'll show you a little bit later. And they're basically pretty easy, check boxes that you can click. The one thing that you really have to be careful with is no liquids down the mouth, because obviously it goes right into its components, electrical components here. This mannequin can become cyanotic, so it gets a little bit of a blue ring around its mouth. You can see that this mannequin also is breathing at the moment, so you can count respirations. It also has the capability from the console computer to change heart and lung sounds. So when you bring in your students or your learners, you want to let them have a chance to put on a stethoscope and listen to the heart and lung sounds. Listen to what normal is. If it's built into your scenario that you have a difficult lung sound, and you should let them listen to that as well so that they know that there's a change from normal. If you don't want to give the scenario away, let them listen to a range of heart sounds. And so they're not exactly led into what the scenario is going to be. You'll see that it has 2 posts here. That's for defibrillation of the baby. So you just will attach defibrillation posts. You can also use pads. This Manikin comes with discs that you can attach sticky pads to. It also has some areas here to put on the monitor, ECG monitors, and that'll allow the baby to come up on the monitor. And that's another good point. When you're doing simulation, you want the participants to act as if it's a normal patient as much as possible. So you want them to put on the saturation monitor so that they actually get a trace. You want them physically to do an intervention so that they actually get the information on the screen. You can do chest compressions on this Manikin, and it's a very robust Manikin. You don't need to worry about breaking its component. It's built for real-time chest compressions. Generally, Manikins have a pulse arm and a IV arm, and this side we've equipped with what we call the false cannula, and we'll talk about that a little bit more, but it's basically a false cannula that is attached to a dump bucket. That way the students or the learners can give as much fluid as the bag will allow, and you can obviously change the bag size, as much fluid or medications as needed without worrying about flooding the Manikin. Because again, a lot of the learners that come through this high fidelity simulation center, we're not focused on if they can put an IV in or not. That's something that you can do in a task trainer situation. The other side, so this would be the IV arm, and this would be for pulses, so you can feel a brachial pulse on this Manikin. The other area to feel for a pulse, which I was getting ready to show you, was the femoral pulses. And these are quite strong in this Manikin, so I would suggest orienting your participants to feel for the femoral pulses as well. You can make the stomach distended. You can also do bowel sounds as well. This Manikin also has the capabilities of putting an IO in either leg. So if you turn the Manikin over, you can see that we've put blood in the legs before. That allows for a flashback. It's also hooked up via tubing to dump buckets. So you can give fluids in the leg and it goes right into a dump bucket as well, so for that realistic appearance. Any questions so far? The purpose of the room orientation or room familiarization is really, again, to show them how to call for help in the setting, show them where the supplies are and what the equipment they're using, let them have some hands-on time and understand what the limitations of the Manikin are. And it's really based on the level of learners. So there may be a skill that you've written into one of your scenarios that you want them to practice ahead of time, or a number of skills. Give them some time or chance to actually do those skills here. Because, for instance, you can needle the chest in this Manikin. So if that's part of your scenario, you want to give them the opportunity to do that as well. Especially if they've never done simulation before, you want to have them, learn how to hook up the monitor and see it on the monitor, and just stop for a few minutes so that they get that chance to really do the skill that you're going to be asking them to do, because that'll really pay off in the debriefing. They won't focus so much on the technology, but more on the methodology, those teamwork skills that you want to focus on, the crisis resource management skills that you want to focus on. Anything else? Sorry, I guess the only other thing I would say is when we come into the room, we have any basic needs that they're going to need out for them. So here's a pediatric trolley, for instance. So anything that they're going to readily need, that we anticipate them readily needing, we have at their disposal. Like if it was a bladder scanner or something, for example, that would be out in the hallway. We would have it ready in the hallway, but not in the room, because it wouldn't normally be in the room. And then the Confederate can go and get that as it's requested, if it's requested. So things that they're going to need on an immediate basis, you want at their disposal and easily accessible. And sometimes you can even put a resus kit out there, and it has, the laryngoscope, and it has the endotracheal tube. So it's not like a treasure hunt finding this, that, or the other thing. It's really about the behavioral component. How do we focus in on a crisis? How can we improve and make ourselves more efficient in a crisis?